As the debates now heat up and play out in this political season, Medicare for All has actually many different meetings. Each of the candidates or proponents seems to have slightly different meaning. I think there is a core of an idea here. If I had to capture it, what all share in common, I guess, is first finding a way that everybody has health coverage, leaving no one out, and trying to simplify the world of coverage and payment so it's more consistent and maybe lower administrative costs. So some common channel of payment, bring it all together. The differences are how to achieve that, and so Medicare for All could literally mean taking Medicare, which is the coverage system we have for people over 65 in this country, and saying it now will cover everybody and administered by a federal agency. We'd have to describe a new benefit package because, Medicare doesn't cover obstetrics. It doesn't have to. But so you'd have to come up with a different way to look at benefits. But it would be exactly what it sounds like. Medicare now is the insurance system for America. One pool. Medicare, Medicaid, commercial insurance is now one payment, one card. That's your American health insurance through Medicare. I think there are some common assumptions, misunderstandings about Medicare for All. The biggest one is a confusion between Medicare for All as a government administered payment system on the one hand, which it is, and a government takeover of delivery of care, like all the hospitals and doctors are now government employees, which it isn't. That's not what's being proposed. And I find lots of people get mixed up about this. They say, no, we're only talking about the payment stream now. Simpler, more accountable, and public. Delivery system stays as you now know it. Another problem is the cost saving side, and this is confusing. So Medicare for All almost certainly would save money, a lot of money. We're spending $3 trillion on health care. I don't know the percent, but there's probably a double-digit percent decrease in that. That's a lot of money to become available. That money goes back to workers and to corporations that need to be competitive. It goes back to government so they can build houses and roads and schools. It goes back to other forms of economic investment in this country. That's true. But if you look at Medicare for All literally, you're taking private streams of payment from your employer, out of pocket from you, streams of payment that are costing you a lot, and you're unifying them in a government payment, which is, I guess, a tax. Call it a fee, call it a whatever, but it's a government fee. Now, in the rhetoric, the opponents point to say, "Oh, look at that! The government's expanding. You have this big tax bill now, and not." You're paying less than you would have otherwise because that money is your money, whether it's coming from your employer or from out of pocket. It is your money. You're going to pay less of your money, but you're paying it to government. And that shift from private flows to public flows is very confusing to people, and it's a opportunity for a lot of demagoguery and misunderstanding. It's hard to sum up what the real pros and cons are, but I basically the pros. A simplified system of payment, a government payment system, let's say through Medicare, has the advantage that it's simpler. So a lot of the administrative costs, which amount to 15 or more % of the total bill, they'll go way down because the Medicare system is a far more efficient administrative system. It just doesn't have all the paperwork and the coding and all that. It's simple. And it gets easier for doctors, easier for nurses, easier for hospitals, and easier for patients. So that's an advantage. Another is that if you literally were to say Medicare for All, what happens now, you have a publicly accountable spokesperson for the interests of patients and families. The only job they have is to protect the beneficiaries. It's a public function, and there's no duty to stockholders or shareholders. There's no game going on here around profit. It's all about making sure people can get the care they get. Another advantage is transparency. If you assume Medicare for All would be, as Medicare is, a public function, then under law, it has to report. It has to say what's going on, tell the prices. think about your insurance company. Do you actually know the prices? Do you know what they're paying the doctor who just saw you, or how much they're actually paying the hospital for the MRI? You don't. You can't find out. Another advantage is we can have a public dialogue about where to put our funding. Your insurance company can decide right now that it just doesn't cover non-essential health benefits, and you have no recourse. Medicare is publicly accountable. You have to have that conversation in the open. And if someone raises a question, you darn well have to answer that question. And so you get a more transparent discussion of coverage. On the con side, we're talking basically about a larger role for government in purchasing. People that don't want big government get worried. They say, well, that'll be a bureaucracy. And that's a management challenge. If we had Medicare for all, whoever wants to pursue that will have to think about how we're going to have a kind of management system that is really sensitive to localities, to states, to the public, instead of being a massive bureaucracy. Right now, the commercial insurer is kind of controlled by their stockholders or their boards of trustees and the economic interests. The Medicare for all, the new oversight is political. It has to be. It's government we're talking about. So you're going to have people change. People will lose their office and get elected. You'll have different presidents, different secretaries of Health and Human Services, different Congress people and oversight, and people do worry about that. And there's pushback on that account. Other people doubt that the savings will be as big as intended, because although we save a lot on administration, now you have lobbyists who can come in and argue for their new device or their pricing, and that will tend to drive prices back up a little bit. And so the argument that Medicare for all will save a lot of money is one that people have to struggle with that. Only if it's correctly set up and correctly managed would that be the case. If that is the case, there's a lot of money to save, though, and I think that's one of the advantages. I think people worry about control, because Medicare for all, if all the payment went through one channel, then you have a very powerful purchaser. Now, it's a purchaser on behalf of the public, publicly accountable, but it's a single purchaser. What does that mean? The competitive market has gone away for provision. Medicare sets the prices. It decides what to pay for heart attacks. There's no competition on that. And frankly, the people that deliver care, the hospitals and the doctors, they're a little worried. They say, do you really want someone across the table from you who's such a powerful purchaser? The proponents say, yes, you do, because that purchaser's standing up for the interests of patients and trying to keep costs under control. The providers say, well, it's arbitrary. They'll take the money away that I need. So you're going to hear that debate.